Hi folks, how you doing? Russell, TrueResults303.com. Check out the website, link in the description box, Mind, Body, Spirit, Fitness. Put in the healing back and health. Once again, when you're at the website, check out the free gifts, free downloads, setting goals, fitness and nutrition. Don't forget to follow on social media, Facebook, Twitter, Google+. The podcast is out there. All those links are down below in description land. Coming at you today with a video on why universal or free healthcare just won't work, right? I think we've got to understand this. This is why it will not work. We are approaching it wrong. Okay? So I was reading this article the other day. It actually popped up in the Catholic Registry, which I think is crazy. But it was kind of like healthcare through a Catholic perspective, I guess, is what he was trying to say. And some things popped up that I thought were very interesting. And I guess it depends on how we look at it. So this is kind of a part 2, so I'll just kind of do a small repeat of part 1. But I think we got to remember that healthcare starts in your home, right? Starts in your home. What are you doing to stay healthy? Now, of course, we've got to understand that sometimes maybe genetics play a part. I heard something the other week where they were saying, you know, like women now, I think it was Angelina Jolie, like she had a breast removed because she had the gene for breast cancer. And I was listening to one of my health podcasts, and the gentleman brought up that just because you have the gene doesn't mean anything, right? The gene still needs to be activated. It's that same concept of, I wish I knew the percentage because I wasn't thinking of bringing this up either, where they talk about like only a certain percentage of the human genome is activated, right? The rest is just sitting there being unused. I think I've heard that somewhere. But, you know, it's that same concept. So just because you have the gene, it doesn't mean anything, right? I mean, you have the gene for breast cancer, but just because you chop your breast off, does that really mean? I mean, the gene isn't in your breast, right? I would assume it's in your DNA code. So does it really matter? I mean, just because you chop it off and put a new, maybe cancer could grow on the new breast silicone thing? Not sure. Not sure how that works, right? But anyways, remember, it always starts with you. Are you exercising? Are you trying to eat healthy? Drink, you know, filtered water. Get outside in nature. Maybe try a multivitamin. Unfortunately, we don't discuss these things with our children. You know, when I was young, I did a lot of partying, did a lot of dumb things. And I've brought it up in another video as well, like the whole concept of free will. Right? We do have the free will to do whatever we want, but we've got to understand that free will comes with the consequence. So if you decide to smoke a pack of cigarettes for 30 years and all of a sudden you get healthy and then you get cancer and you're upset, well, that's what happens when you smoke cigarettes for 30 years, right? It's the same concept. So just remember, healthcare starts in the home. Starts with you as a parent. Are you feeding your child quality food? So that's always number one. Starts at home. Okay. So I'm trying to see where to start here. So the next problem with healthcare is, and this guy brought it up, right? So if you have car insurance doesn't pay for tire rotations, oil changes, new tires, anything like that, right? It really only pays for an accident. If you get in an accident or if you hurt somebody, right? It doesn't pay for annual checkups if we're going to go health insurance wise. So that's the biggest downfall. We decide that all of a sudden now insurance has to pay for everything. If I'm going to the doctor, they have to pay for that. If I'm going to get medication, I got to pay for that. If I'm going to get blood work, got to pay for that. If I'm going this and that, insurance has got to pay for it. And in doing that, we as people don't even know what things cost, right? Like seriously, should insurance pay for Viagra for men? No. Just like it shouldn't pay for birth control for women. It shouldn't be paying for these things. And in doing so, we never see what the price is. So now all of a sudden, these companies can charge insurance as much as they want, because what does the insurance company care? They're just gonna push the cost onto you, onto me. So we definitely, that's the biggest problem. right? We try to use health insurance as an everything, which we shouldn't be, just like car insurance isn't an everything. That's why some people can get away with paying, you know, less than $1,000 a year for car insurance, less than $800 a year for car insurance. Why? Because you have a good record and you're not getting in accidents, you're not having to use it, so it's a lot cheaper. So that's how we can fix this health insurance issue, right? But it's going to take a lot of time or a lot of struggle to get back to that point, because once again, sometimes things have to get worse before they get better. And this is what we had before, the universal health care, Obamacare, whatever you want to call it. It was called catastrophe insurance, where you could literally pay like $100 a month, 50, $70 a month, and it was going to be, if you get in an accident, if you break your arm, your insurance would cover a broken arm. Your insurance would cover an appendectomy or whatever they call it, right? Something along those lines. The insurance would cover that. But if you wanted to go get a checkup and you want to do these other things, then no. Sorry, it doesn't cover that, right? Why? Because once again, that's the beauty, I think, of that catastrophe insurance type thing. That's why people don't like it. Because it forces you, the person, me, the person, to take some responsibility for our own health, right? People now, they're on all these medications, when in reality, all they have to do is eat healthier, get off the couch and go exercise, get out and get out into the open, and a lot of these issues would go away if you lost 20, 30, 40 pounds. But instead, they'd rather just pop a pill every day for the rest of their lives because that's simple. But that's not how it works, right? That's why health insurance is out of control. My buddy doesn't have insurance. He messed his finger up. Went to the doctor, and he's like, I literally felt like a horrible person. He's like, I went in there, wanted to get x-rays and stuff on my finger, and they're like, oh, okay, what's your insurance? Oh, I don't have insurance. I just want to pay whatever the cost is. And everybody, he said, in the emergency room was just like, whoa, what? He doesn't have insurance? What? It's great. Yeah, people don't have insurance. People don't have insurance. And then all of a sudden, the nurses and the staff were like, we don't even know what it would cost. And it's like, how can you not know what it costs, right? How can you not know? And then the thing he brought up, let's see if he says it in here. The one thing he brought up that is, he's like, I understand, right? Like an x-ray machine costs a lot of money, right? But if you're charging the insurance company $5,000 for an x-ray, $2,000 for $1,000 for an x-ray, right? $1,000 for an x-ray. I guarantee you, I don't know I should have done my homework. I don't know what the average x-ray machine costs, right? But if you're charging $100 and you do 100 of them, what is that, $10,000? My math might be off. $1,000? $1,000 would be 10. So yeah, $10,000, right? So I guarantee you they're doing more than 100. They're probably doing that in a month, which means that piece of equipment is already paid off. So why does it still cost that much if the piece of equipment's paid off? It shouldn't be costing that much, right? And you can talk about doctors and all this. Hey, eventually their pay is going to start coming down too, because robots are going to be able to do these things, right? So once again, once these robots come into play, things are going to change. But that's something to think about. We are going in the wrong direction with healthcare, right? This free healthcare for everybody, that's what it should be, if anything. It should just be catastrophe insurance. Catastrophe insurance free for everybody. If you get in an accident, if you need to go to the hospital in an emergency situation, it will be paid for. But sorry, if you want to treat your body like crap, right? If you want to seriously treat your body like crap and be reliant on all these prescription drugs for the rest of your life, the American taxpayer shouldn't be paying for that. And I understand sometimes these things happen, Hopefully this doesn't turn around back on me and it's something that I have to deal with. But catastrophe insurance for everybody, yes. That's where it stops. We don't need free insurance for everybody, every little thing. That's why it's out of control, because we don't want to take responsibility. And then he talked about in here, and then it just got worse when companies started to add benefits, right? So now they're adding onto it the health insurance and these types of things. And then once again, now with healthcare prices going up, the company can say, well, we have to pay more for health insurance, so we can't give you a raise, right? Benefits are like a raise. Like, you don't have to pay your health insurance. That's like a pay raise in itself. And now that prices are going up, we can't afford to give you a raise because we have to pay more for your health insurance. Well, you know what? We don't. He brought up in the article, we don't ask our employer to pay for our food. We don't ask our employer to pay for our car. We don't ask them to pay for anything else. So why do we expect them to give health insurance? Right? Because once again, we don't know what these insurance companies are being charged. That's why everything's so out of control. So we need to start taking responsibility, and that's what it all truly comes down to. Us as citizens taking responsibility, and I know it's difficult because nobody wants to, right? I don't want to take responsibility for eating healthy, getting up, going to work, paying my bills, uh, exercising, going to family events, doing my volunteer work, making my YouTube videos, making my podcast, editing everything, posting it on Facebook, posting it on social media, trying to advertise personal training, getting up at 4 o'clock in the morning every day so I can go through my morning routine so I can train my clients at 5:30 in the morning and then go to work and then come home. Now I got a girlfriend, got to hang out with her, got to do this. Nobody wants to do any of that, but we have to. That's the way it is, right? And everything I just rattled off, that's my life. And I still need to read books to try and get more information to give more videos to you. And there it goes again. So I'm going to end it right there. It keeps happening. That's what happens when you bulk cook on a video day. So once again, something to think about. I want you to please join the community. Follow on social media, Facebook, Twitter, Google+. The podcast is out there as well. Subscribe to this channel. Share and like these videos.